Assalamu alaikum. So this is our first lecture of approach to patients with rheumatological disease. Rheumatological disease में हम basically उन patients को लेते हैं in which there is involvement of either um, uh, in which there is involvement of either muscles, joints, bones, so anything related to the locomotor system. Reuma means to flow, and if a patient has any problem with their flow of movement, we are going to think about rheumatological disease. You would have seen patients having difficulty walking in your clinics. You would have seen patients having swollen joints in the clinics, and you would also have observed people walking with difficulty during social gatherings. So the question must have come into your mind, what is the problem that the patients are encountering? Any problem associated with this unit, which can involve the bones, the articular surfaces, any component of the joint, the ligaments, the intra-articular parts of the joint like the menisci, the synovial membrane, or the muscles associated with the joint, or the tendons, or the tendinous insertions, or the ligamentous insertions. So any part of this unit can be involved in patients who have got rheumatological disease. In order to make a diagnosis, the purpose of today's lecture is so that you can diagnose a rheumatological illness. You need to make an accurate diagnosis so that an appropriate management plan can be instituted. You need also to assess the severity and the complications of the condition so that at least we may arrest and prevent further complications from occurring for these patients. In order to reach these objectives, we need firstly to answer some questions. लेकिन ये slide इधर है in order to make you aware of the number of joints and their involvement which can occur in rheumatological diseases. ये वाला diagram अगर आप label कर लें तो accurate diagnosis of a rheumatological disease becomes very easy. In order to get to a diagnosis, a good history and physical examination is a must. You get to a diagnosis in 80% of the cases if you take a good history. 10%, 10 to 15% is added by a good examination. So 90 to 95% of the cases, if you take a good history and you examine the patient completely, you will get to a diagnosis. Lab tests will help in cases where there's ambiguity, and it will help you confirm the diagnosis. But you need to be able to identify the specific lab tests which you are going to order and what you will do if it's abnormal. पूरी list tests की नहीं करा देनी हमने patients की. A statement I made in the beginning of the lecture was that a person having difficulty walking, having difficulty in flow of movement, but the difficulty can be because of a neurological cause. अगर हमने rheumatological cause देखना है, तो there are 3 simple screening questions. If the patient answers in affirmative to any of these questions, you are going to suspect that the patient has got a rheumatological disease. The first question is, do you have any pain or stiffness in any of your muscles, joints, or back? Then, तो ये आपका axial part of the body, the rheumatological conditions affecting the trunk and the back को assess कर लेगा. Then upper limb को कैसे assess करेगा? Can you dress and undress yourself completely without any difficulty? This would including doing up the buttons and opening the buttons. एंड लोअर लिम्ब को किस क्वेश्चन से हम लोअर लिम्ब इन्वॉल्वमेंट को किस क्वेश्चन से हम करेंगे? कैन यू वॉक अप एंड डाउन स्टेयर्स विदाउट एनी डिफिकल्टी? हमने अपर लिम्स भी असेस कर लिए, लोअर लिम्स भी असेस कर लिए और ट्रंक भी असेस कर लिया. If there is yes to any of these questions, we are going to go into further details. और इन डिटेल्स में हिस्ट्री में जरूर जो पूछना है, इफ देयर इज पेन, तो पेन के जो सोक्रेटिस वाला आपके पास एक्रोनिम था उसके सारे पॉइंट्स पूछने हैं, स्पेशली साइड रेडिएशन सिवेरिटी और एट रेस्ट ज्यादा होता है या ऑन यूसेज ज्यादा होता है. Is the pain more in the morning or is the pain more at the end of the day? Does the patient have any stiffness? Stiffness को उर्दू में patient कहता है अकड़ाव महसूस होता है. So that is a subjective feeling of inability to move freely, or usually stiffness occurs after a prolonged period of immobility. तो usually रात में patient rest कर रहा होता है तो सुबह उठता है तो morning stiffness होती है. Then you are going to ask about any swelling, कि कहीं सूजन महसूस हो रही है. The swelling in any part of the musculoskeletal system. और ये भी क्वेश्चन पूछेंगे कि if there's swelling of the joints, so which joints, is it constant or episodic, and what is the duration of the swelling? Does the patient have any systemic illness associated with this condition? For example, if the patient is having fever, malaise, fatigue, loss of weight. एक चीज याद रखनी है, हम फीवर सोचते हैं ना तो हम सोचते हैं इन्फेक्शन. Fever can be because of other conditions, and one of those conditions is a rheumatological disease. Then you are going to ask about extra articular manifestation. हमने कहा कि rheumatological disease जो है that affects any part of the musculoskeletal system. वो तो primary involvement है. But because the musculoskeletal systems are formed with the connective tissues, तो इसमें rheumatological diseases में connective tissue diseases होती हैं. And these are autoimmune diseases with antibodies directed against the nuclear antigens, with antibodies directed against some mitochondrial elements. So multi-systemic effects हो सकते हैं. Multi-systemic यानी आपके मस्कुलोस्केलेटल सिस्टम से हटके आईज, जीआई, pulmonary, cardiovascular, nervous system. So any part can be involved, and we need to have we need to ask specific questions from the patients in order to find out whether there are any extra articular manifestations or not. So if you look at this picture, you can see that there's involvement of the skin and there's involvement of the lips. So there's vasculitis of the lips. Oral ulceration or the mucosal membrane is affected. So these are extra articular manifestations. Hair loss. So skin is affected. Raynaud's phenomenon is seen in this picture, and you can see that that is involvement of the arteries basically. Then let me take you a little bit into detail of the patterns of pain. Pain का जब हम क्वेश्चन कर रहे होते हैं ना तो हमें ये सोचना होता है कि what sort of a pain is this? Is this pain because of degeneration of the articular cartilage? जब degenerative pain होती है तो that pain occurs on use of joint, यानी person is mobile throughout the day and at the end of the day they will have pain in their knee joints. So osteoarthritis is a degenerative joint disease. So the patient will have pain at the end of the day, will have more pain at the end of the day. In inflammatory joint pains, the pain is more in the mornings, along with prolonged stiffness in the morning and after prolonged rest. So that would tell you that this is an inflammatory arthritis. If it is a mechanical joint pain, for example, there is rupture of any ligament, so जब joint use होगा तो उस वक्त पेन होगा, अगर रेस्ट पे रहेगा तो पेन नहीं होगा. If there is bone pain, like for example in an osteosarcoma or with Paget's disease, it occurs at rest and is more at night. Neuropathic pain को भी rule out करना जरूरी है, and this is diffuse pain and paresthesias in the dermatomes, and they are worsened by specific activity जिसके अंदर compression हो रहा हो. So हमने पहले we had asked 3 questions in order to find out whether the patient is suffering from a rheumatological disease or not, and those questions were, do you have any pain, stiffness anywhere in your body, specifically in the back and the shoulders? Do you have any difficulty in dressing and undressing yourself completely? Do you have any problem in climbing up and down the stairs? अगर इनमें से किसी एक क्वेश्चन को yes का आंसर मिला है, तो ask these 5 questions. We need to take a detailed history because in most of the rheumatological diseases, the diagnosis is based on clinical grounds and confirmed on labs. So the questions are, is the involvement, are the symptoms articular or non-articular? Are the symptoms acute or chronic? Are the symptoms inflammatory or non-inflammatory? What is the pattern of joint involvement? And what are the, if there are any extra-articular features, what are they? And lastly, we are going to order investigations that will help to confirm our clinical impression and will help sort out the differential diagnosis. So the first question was, is the pain articular or non-articular? So is the pain localized to a specific joint? और अगर ये भी पूछना है कि in both passive और active ranges of motion में पेन होता है और क्या ये ranges restricted हैं या नहीं. अगर नॉन आर्टिकुलर पेन है यानी वो जॉइंट स्ट्रक्चर के अलावा, तो पता वी शुड नो कि वेदर दिस पेन इज इन द बर्सा और अ टेंडन और अ मसल. सो अगर वो स्पेसिफिक एरिया इन्वॉल्व होगा तो वो स्पेसिफिक मूवमेंट में, जिस मूवमेंट में वो स्ट्रक्चर इन्वॉल्व होगा उस प्लेन ऑफ मूवमेंट में पेन होगी और हो सकता है रिस्ट्रिक्शन ऑफ मूवमेंट हो. If it's diffuse non-articular pain, so then think about fibromyalgias. The second question was, is the pain acute or chronic? Acute or chronic को basically duration जिस पे हम arbitrarily इसको divide करते हैं, that is 6 weeks. I said arbitrarily, but that is not very correct. लेकिन 6 weeks से अगर कम की duration हो, तो think about viral arthritis, reactive arthritis और gout. अगर 6 weeks से ज़्यादा की हो, तो then think of a chronic inflammatory arthritis like rheumatoid arthritis or a non-inflammatory arthritis like osteoarthritis. So 6 weeks का एक period हमें differentiate करेगा कि is it acute or chronic. जैसे से acute में septic arthritis भी आ सकता है. I'm just giving you examples so that when you ask these questions, you know what are you thinking about. So the first question was that are the symptoms articular or non-articular? Is the pain articular or non-articular? Are the symptoms acute or chronic? और इसको हमने 6 weeks की basis पे divide किया है. And are the symptoms inflammatory or non-inflammatory? तो अगर joint pain inflammatory होगा, तो उसमें the 5 cardinal signs of inflammation होंगे. And you know what they are. They are calor, rubor, tumor, और क्या था, dolor and functionalism. So increased temperature, redness, swelling, pain, and loss of function. Then another question would be if there's prolonged morning stiffness. Books में half 1 hour का लिखा हुआ है, लेकिन half hour से ज़्यादा की अगर morning stiffness हो, तो that is indicative of an inflammatory joint pain. Systemic symptoms like fever, fatigue, and weight loss. And अगर आप labs करा रहे हैं, तो this is going to be confirmed by an elevated inflammatory markers, which are ESR and C-reactive protein. If you look in this picture, you can see that there is inflammation and swelling of different joints. Same here. Same here. So this is not very clear in the picture, but there is redness and swelling of the first metatarsophalangeal joint. You can see swelling and deformities in the joints. Patterns की तब हम बाद में आएंगे. And the next point is, the first question was articular, non-articular, then acute or chronic, then inflammatory and non-inflammatory, and what is the pattern of joint involvement. So pattern of joint involvement में you are going to ask three type of questions. कि sequence of involvement क्या थी? क्या did the pain start in one joint? It became fine, and then it flitted on to another joint, which became fine, and then moved to a third joint. So that is, the pain is migrating over multiple joints. So a migratory polyarthritis. But if the patient has got a pain which started in the small joints of the fingers, then involved the metacarpophalangeal joints, then involved the wrist, that is an additive. So पहले कुछ joints में थी, उनमें pain was constant, but then some other joints were added on. So this would be an additive polyarthritis. And intermittent arthritis would be that there is swelling of one joint and then it goes away. Then after some months or after some trauma or a triggering factor, the joint became swollen again. So that would be an intermittent, and they are repetitive acute attacks with complete remission in between, which is typical of gout. तो हमने pattern of joint involvement में हमने कहा था sequence क्या है. Then what is the number of joints involved? So monoarthritis, we देखें ना, acute monoarthritis, we are going to think about septic arthritis and crystal arthropathy. Oligoarthritis is 2 to 4 joints. So अगर oligoarthritis है, तो we are going to think about reactive arthritis, we're going to think about psoriatic arthritis. और अगर polyarthritis है, more than 4 joints involved, तो we are going to think about जो इसका prototype हम for example लेते हैं, rheumatoid arthritis. तो हमने pattern of joint involvement में हमने sequence किया है और हमने कहा number of joints कितने हैं. Then the distribution of the joints, is it symmetrical, and both the small joints of the hands, of both hands are involved, या इधर का wrist, right side का wrist है, left side का elbow है, left side का knee है. So that would be an asymmetrical involvement of the joints. Is it axial or peripheral? Axial means involving the axis of the human body, like the vertebral column. The vertebral column and the sacroiliac joints. So axial involvement में हम इसको याद रखेंगे कि any joint of the vertebral column and the sacroiliac joints. और peripheral joints हम वो कहेंगे जो limbs के upper and lower limbs के joints. Then is there involvement of the large joints or the small joints? ये जो questions है ना, they will help when you ask these questions. Put them on the rheumatology homunculus. अगर आप इस first picture की तरफ देखें, तो this is symmetrical. अच्छा, पहले तो हम कहें this is polyarthritis, more than 4 joint areas involved, और symmetrical भी है, axis को नहीं involve कर रहा, ठीक है, और mostly peripheral joints involve हो रहे हैं. तो इसकी picture fits onto rheumatoid arthritis. If you look at this joint, so this is not symmetrical. It is involving a sacroiliac joint, और हमने कहा था axial involvement में हम sacroiliac joint को include करेंगे. And it is involving some small joints and some large joints. So this would be typical of what rheumatological disease. I'm going to leave it to you in order to find out during the lecture. इस पिक्चर के अंदर there is axial involvement involving the vertebral joints and the sacroiliac joints and some large joints. In this joint, there is symmetrical involvement with involvement of axis, some joints of the axis and some of the periphery. We will discuss this during the lecture. फिर specifically hand की involvement भी अगर आप देख लें तो the questions were the same कि symmetrical होगा, कौन से joints involved होंगे and the number of joints कितने involved होंगे. This will help you get to a diagnosis. तो हमें diagnosis reach करने के लिए हमने पहला तो जो questions हमने किए थे वो हमने किए थे कि is it a rheumatological disease, और अगर if the patient says that I've got pain, stiffness in any part of my body, if there is difficulty in dressing and undressing oneself, if there's difficulty in walking up and down the stairs, so we are going to think of a rheumatological disease. If any question is answered in yes, if any of these three questions is answered in yes, then we are going to ask 5 questions. Is the involvement articular, non-articular? Is it acute or chronic? Is it inflammatory and non-inflammatory? What is the pattern of joint involvement? And the 5th question is, are there any extra articular manifestations? For example, loss of hair, photosensitivity, dryness of mucous membranes, mouth ulcers, etc. So GI, lungs, heart, kidneys, neurology, any system can be involved. What do you see in this picture? This is an X-ray of the chest showing pulmonary fibrosis. So this can be a feature of a rheumatological disease. This X-ray is showing cardiomegaly with a water bottle appearance of the heart. This specific appearance is associated with pericardial effusion, which can be a feature of a rheumatological disease. So, हमने history में these are the specific questions that you're going to ask. लेकिन एक चीज जो याद रखने की जरूरत है वो ये है कि बाकी हिस्ट्री भी तो कंप्लीटली लेनी ही लेनी है, यानी हर सिम्टम का OPQRST-A पूछना है और बाकी जो जिस तरह से प्रेजेंटिंग कंप्लेंट, हिस्ट्री प्रेजेंटिंग इलनेस, पास्ट हिस्ट्री, सोशल इकोनॉमिक हिस्ट्री, ड्रग हिस्ट्री, family history, personal history, everything has got to be taken in detail. And when you come to the examination, after doing the general physical examination and the systemic examination, in the musculoskeletal examination, you're going to examine every joint and do inspection, palpation, movement, and you can extend the examination. So you inspect for inflammatory signs, you palpate for inflammatory signs, you do ask the patient for active movements and you assess the range of movements and passive movements, and you assess in which direction does the patient have symptoms and is there any crepitus or not, is there any fluctuation or not. You may extend the examination accordingly, and general physical examination is an important part of the rheumatological review. हर पेशेंट की ये स्लाइड फोकसेस ऑन के कौन सी इन्वेस्टिगेशंस आपने तकरीबन हर पेशेंट में करनी है, लेकिन the whole list of investigations cannot be ordered for every patient. Based on your history and examination, you can tailor the investigations for the specific patient. लेकिन अपने mind may make a mind map that we need to do hematological investigations, we need to do biochemistry, we may need to do immunology, we may need to do synovial fluid, and we may need to do radiology of if there is involvement of the hematological system. In hematology, you're going to do CBC and inflammatory markers. We will discuss specifically with every disease what are you expecting to find in CBC. And if there's any active inflammation, of course, inflammatory markers like ESR and CRP are going to be high. Biochemistry may be required in specific diseases, like in gout, you're going to get serum uric acid. In SLE, if there's renal involvement, or if in any other rheumatological disease there's renal involvement, you'll need to do renal function tests, which will include serum urea, serum creatinine, and serum electrolytes. So depending on the history and the examination, you will tailor these investigations. If you're suspecting that the patient has got an autoimmune disease, then immunology, uh, immunological tests will be ordered for the patient. If the patient has got uh, acute monoarthritis, then synovial fluid analysis is a must. And for involvement of the joints, of course, we may need to do X-rays. X-rays well developed diseases में यानी जिनकी progression हो चुकी हो उसके अंदर findings नजर आती हैं. If you're looking for earlier findings in a patient who has not developed destruction of the joint, you do an MRI. अगर रिफ्यूजन जॉइंट में है तो अल्ट्रासाउंड जॉइंट का भी कर सकते हैं और बोन की डेंसिटी देखने के लिए डेक्सा स्कैन. सो दीज आर द रेडियोलॉजिकल इन्वेस्टिगेशंस दैट यू मे नीड टू डू फॉर योर पेशेंट्स. अब हर रेमेटोलॉजिकल डिजीज की मैनेजमेंट क्या होगी, नॉन फार्माकोलॉजिकल और फार्माकोलॉजिकल. नॉन फार्माकोलॉजिकल में ये क्या स्पेसिफिक पेशेंट को टेस्ट करने की जरूरत है, तो अक्यूट फेजेस में यूजुअली द पेशेंट इज आस्क्ड टू टेस्ट, एंड व्हेन द disease has remitted, is in remission, we may ask the patient to go for a specific physiotherapy. Then non-pharmacological management में joint splintage भी included होता है, hot and cold fomentation involved हो सकती है. Then we come to pharmacological management. So pharmacological management में you give drugs to reduce the inflammation and you give drugs to reduce the disease activity. So anti-inflammatory agent and disease-modifying anti-rheumatic agents. Anti-inflammatory agents, when you start with NSAIDs, and if NSAIDs are not effective or the disease is very severe, you start with steroids. Disease-modifying anti-rheumatic agents, there are non-biologics or conventional DMRDs and the biologics. So specific agents are used for specific diseases, which we will study when we are doing those diseases. And of course, if there is involvement, surgery is required, that can also be a feature of management of rheumatological diseases. So any questions that we have will be answered in the lecture. Thank you.